A dental implant is a screw typically made out of titanium that's placed in the patient's jaw, either the upper or lower jaw, to serve as an artificial root for a crown or a new tooth. Most patients who are in general good health are candidates for dental implants, provided, however, that in the area where the implant needs to go, there's enough bone. And if there's not enough bone, they're healthy enough to have procedures done to boost up the bone in the area to support the screw. If a patient is missing a tooth, there are several disadvantages. One primary disadvantage that people would think of would be cosmetically. When you smile, you miss the tooth. You have a dark space or a dark corridor if you have multiple teeth missing. Additionally, from a functional standpoint, it can compromise your ability to chew. You don't eat properly. You can have problems speaking. You can leak air through the space in the teeth. Long term, many neighboring teeth on either side of the missing tooth can drift. If the teeth drift, they can get periodontal disease, bone loss, and even loss of those teeth in the future. If a patient is missing a tooth, there are basically three ways that we can replace the tooth. The first one would be the dental implant, which is a titanium screw that's placed in the gap where the missing tooth is, and a crown is placed on the top of it. Previous to dental implants, the most common solution was probably a 3-unit bridge or a permanent bridge, where you have a crown on the front and the rear of the gap with a replacement tooth in between. The disadvantage to the bridge option, however, is that it requires that the teeth neighboring the missing tooth be ground down or prepared, which can compromise their health and function later on. The third way to replace a missing tooth is that of a removable partial denture, where an appliance is made with typically some pink plastic gum resembling material with teeth growing out of it that goes in and out of the missing tooth area and replaces the function and the cosmetics of the tooth. The implant option typically is considered superior by most patients because it most closely resembles the look and feel of the natural tooth. The patients can floss between the teeth. It feels normal. The bridge option is a little bit different in that the 3 teeth together, the crown on the front, the crown behind, and the replacement tooth are all welded together as a 3-tooth appliance. You can no longer floss between the teeth naturally, and it requires a little bit more effort to get underneath the teeth or the bridge to clean. A removable appliance or a removable partial denture is just that, removable. It doesn't have the support that either a bridge or an implant has, and a lot of people have difficulty both in function and aesthetics with the removable device. A dental implant typically provides the patient with the most realistic, long-lasting replacement for a missing tooth.